If I can have the next slide. Our next, after we get the analytical panel and the results from that analyzed, and by the way, we have 2 individuals that are neutral, and they are the ones that will be collecting all the results both for the analytical and the clinical panel, and so they will get the results and then report back to us on the outcomes of those results. The clinical panel is again, we had to wait for the Institutional Review Board approval for 25 chronic fatigue syndrome patients. The plasma and whole blood panels will be matched, 250 plasma or whole blood specimens from blood donors in the Reno area, 25 Whitman-Peterson Institute XMRV plus CFS blood samples, and 25 control samples, both positive and negative. And then also to let you know that we are continuing to work on the progress for a serological assay. This is under development. The National Cancer Institute is busy trying to develop antibodies, and I believe that there's at least one commercial source out there that is also working on their methodology. Once these methods get put into place, it will be necessary to standardize those, especially with some of the analytical and clinical panels that we have. As you can see with the next slide, there's numerous publications that have come out since the October 8th publication. The 3 that followed in January and February were reported negative results, but I think that as we develop more and more procedures and also be able to standardize the procedures, I think that we'll all be playing on a level playing field, and that I would believe that there would be probably even articles waiting in the wings right now to come forward. So we are continuing to investigate the literature and to make sure that we are keeping on top of all the research findings throughout the world. One of the areas, next slide please, one of the areas that I'm very interested in once we do standardize the methodology is the epidemiological findings. What we know today is that there's confounding association between XMRV and chronic fatigue syndrome. And with more data coming out, maybe the results may not be so confounding, but right at the present time we also know that there's no epidemiological association has been demonstrated with blood transfusion. There are confounding associations between XMRV and familial cases of prostate cancer. The prevalence of XMRV in blood donors is not known at the present time, although in the Science paper that was 3.6 or 3.7%, and so we're looking at developing the prevalence in the donor population, and that's why the clinical studies will have a certain number of donors. And we also know that the XMRV assays, both serological and nucleic acid testing, need further development. We have investigated quite a bit of the literature search, and I will go a little bit through that in a few minutes, but then also we have looked at different repositories that we potentially could do some investigation. With the RED study, we do have a repository linking donors and recipients. The NIH has a repository, and various repositories we have identified throughout the world. Let me just quickly turn to the next association with prostate cancer, and we've done quite a bit of literature search. The first 2 articles there really are confounding in the fact that they use the same cohort, but there is a difference. Basically, one says that there is a relationship with cancer, and the other one, but not prostate cancer, and then the other article from Japan also says that there is a correlation with prostate cancer. So we're still trying to work out the relationship and also understand those 2 studies. But in looking at the studies that have the largest numbers, There was a study conducted in Sweden. It included 28,000 non-transfused patients and 1,500 transfused patients from 1981 to 1991, and this really has not shown any relationship with cancer or prostate cancer and transfusion. One of the biggest studies that the NIH has funded is the SCANDAT, and again, that has not shown any indication between transfusion and the onset or predisposing the individual to prostate cancer. Next slide. We've also found one article that was really in 1991, and again, it was a controlled study. It used a questionnaire, and there were no, although there were no cases received blood transfusion, while 2 of the control did receive, and there was no correlation with transfusion. So where does that put us? Well, that's why we're still trying to move forward in standardizing the procedure, and we're very anxious to be able to get into some of the repositories and to identify if there is a relationship, because now we do have the papers out there that show XMRV association with prostate and XMRV associated with the chronic fatigue syndrome. Let me move then to our current blood donor screening status. Many people have said, well, why aren't you deferring donors for chronic fatigue syndrome? Next slide, please. There you go. Thank you. We basically believe that there are safeguards put into place at the present time, and that we do have various standards. As I said earlier, our private sector partner, the AABB, actually develops the professional standards for the blood community, and their standard really lays out that a prospective donor shall appear to be in good health and shall be free from major organ disease, cancer, or any abnormal bleeding tendency unless determined eligible by a medical director. And then also we do have the Code of Federal Regulation that really talks about the suitability of donors as a source of whole blood shall be determined by a qualified physician or a person under the supervision of a trained or in determining suitability, and the qualification is except as provided in the paragraph F of this section. For autologous blood, a person may not serve as a source of whole blood more than 8 weeks. In addition, donors shall be in good health as indicated, and it goes down to indicate some of the criteria. In October 2006, there was a unified donor questionnaire that was approved by the Food and Drug Administration. This was put forward by the AABB, and the very first question that is asked is feeling healthy and well today. So at the present time, we are holding to those criteria as far as the eligibility of donors, making sure that a donor is in good health. If there's any reason to doubt, that individual should be questioned further by the medical director. Next slide, please. However, we do recognize that there are other countries that have moved forward with deferral of blood donors. Canadian Blood Services, which does not speak for Quebec, has put in an indefinite deferral for the history of chronic fatigue syndrome, although there is no question that is asked. Only if the individual comes forward and says, I have been diagnosed with chronic fatigue syndrome, would that individual be deferred from blood donation. Quebec has taken a position of waiting and seeing. The Australian Red Cross implemented a 2-year moratorium on accepting blood donors with a history of chronic fatigue. Again, there is no question asked. The previous policy was to defer donors only for active chronic fatigue. And then in New Zealand, it changed the policy from an indefinite deferral for active chronic fatigue to an indefinite deferral for a history. Again, there is no specific screening question that is asked of the donor. All of this has to be voluntary information that the donor presents.